I want to discuss today with you life and health. And my first slide shows you the ultimate experience. Remember, we all have watched the Rolling Stones, sometimes during our life. But these guys are all retired, according to the official definitions. They are way beyond 65. And they are still rocking and rolling. Maybe a little bit less of the other stuff. So that is what I envision in my future. When I retire, I would like to retire like the Rolling Stones. In an audience like this, in a theater like this, and hundreds of thousands of people shouting at me. That would be my perfect dream of retirement. When is retirement due? And that's a message that not many people understand. But our life has prolonged dramatically in the last 50, 60 years. And this is a graph showing that with increasing year, our life expectancy increases. And every 10 years that we live, the expectancy until the end of our life increases with 2.5 years. Let me put it very clearly. If you survive this week, by Friday, you will get another 2.5 days. Unfortunately, not on Friday, but in the future. But you will get them, I promise. So life expectancy is expanding very, very rapidly. And that is intriguing. And we ask ourselves the question, how come? How come is our life expectancy increasing so fast? We must be doing something extremely good. And yes, we are. Basically, there are three elements why our life expectancy is growing. And it's not only growing in this country, it's growing in almost every country in the world. From the US to China, even many African countries, there is an increase in life expectancy. Reason number one is that we eat and live healthier. We eat less fatty foods. We eat less salty foods. We smoke dramatically less. Imagine that this talk would be given 50 years ago. I bet I would be standing here smoking, and maybe you were also allowed to smoke. So we live healthier. That's reason number one. Reason number two is that the environment is also much healthier. Right, we live in the Netherlands, and we are well known for our canals. So we have the canals in all the cities. 30 years ago, if you would swim in the canal, you would get sick. Nowadays, if you swim in the canal, nothing happens. We even organize swimming races in canals nowadays. Look at air pollution. In most cities, air pollution has gone down dramatically. So the air that we breathe is much healthier. Because many cars, not all cars, but many cars, pollute the environment less. That probably adds another year of our life expectancy. And the third reason, a very important reason, is that we are wealthier than before. So if you have more wealth, more income, you have less stress in life. You can afford to organize your life much better. So that is the good news. We live longer than ever before. We are doing a great job. Are all people living that long? And the obvious answer is no. Unfortunately, not all people have exactly the same life expectancy. That would be rather annoying if you know that at a given day you would drop dead. So there are huge differences. And one of the differences that we are interested in all around the world is what we call inequalities. If you compare highly educated persons to lower educated persons all across the globe, the difference is 7 to 10 years. Even in the city where we are right now, city of Rotterdam, we have huge differences in life expectancy. And this is depicted here. If you take the metro, and you take the metro in the outskirts of town, and you go to the inner districts of town, you see that the life expectancy of a male living there drops from 80.6 years to 72.9. That is a huge difference. And this is not only happening in our city, this is happening in all cities in the world. This is in essence the debate about urban health. Guess what happens? Would you rather travel from the outskirts to the inner city or from the inner city to the outskirts? It's a 30-minute metro ride. If you start in the inner city and you travel to the outskirts, will your life expectancy increase by 7 years? That would be the perfect anti-aging cure. All tourists coming to Rotterdam to gain 7 years in life? No, it's not that easy. Because it depends on where you live, what you do. So, in the outskirts, different people live in these districts than in the inner city districts. So, what can we do? Why are these differences in society? Well, we know, I already explained, lifestyle factors, smoking, eating increases. If you behave healthy, increases your life expectancy. There are huge differences between different people in society, different neighborhoods. Environmental differences. But one of the main differences that I want to talk to you about today also is work, paid employment. How important is paid employment for your health, for your wealth, for your happiness? And I cannot better depict it than these two guys. You see them out on the streets, construction workers, and will they be still working like the Rolling Stones when they are 70? Imagine that you see the swinging construction worker carrying heavy loads when he's 70 in your street. No, that's not going to happen. Because the work is too strenuous, too tough. So what are the challenges that we are facing? One is, if you get older, you are more likely to get a disease. And one of the challenges we have in society is, can we keep people with a chronic disease in paid employment? And that's depicted here. If you live in a country like Switzerland, the likelihood that if you have a chronic disease, that you drop out of paid employment is severely smaller than if you live in Spain and Poland. In Poland, if you have a chronic disease, the likelihood that you work is 35% than if you don't have a chronic disease. So a disease pushes you out of work. And we should prevent that happening. The other way is also true. If you have a disease or a handicap, and you enter paid employment, your health improves. We have studied many long-term unemployed workers across the Netherlands, and we notice again and again and again, if they enter paid employment after a period of being out of employment, their health improves immediately. So work is a very good medication. It improves your health. And why is that? Why is work so important for our health? And we have three big reasons. The first one, work is a vitamin. Work acts as a vitamin. You go to work, you do stuff together with your colleagues, you achieve things that you want to achieve. That acts as a vitamin. You get energy out of work. You are happy that you are achieving things at work. So work acts as a vitamin. Second, Work is also important for your societal position. If you have an interesting paid job, you don't end up in the kitchen at parties. Because you can tell to people how important your job is, what you do in your job. You meet interesting people, you do interesting stuff. So people listen to you, people want to connect with you. And third of all, having a job provides you with an income. And if you have an income, you can pay off literally the stress that comes with life. I know that most of you think, well, in my job it's extremely busy and I'm tired at the end of the week. But remember not having a job. What will happen if you suddenly are out of a job? We know from our studies what happens. You probably become a little bit of a couch potato. You drink a little bit more, even a lot more. Maybe you start smoking again. And although you have plenty of time, you become less physically active. So, health and employment are two elements of a coin that is extremely important for society. And that is part of my research and why I am fascinated by the development in work. This slide shows you. Some people say sitting is the new smoking. Well, you are all sitting here, not smoking. I think it's much healthier to sit here than to smoke. But we have to improve on our sedentary lifestyle. And that's the challenge, to be more physically active in your job. Then your job even becomes healthier than it is already now. And the other challenge is that although you may be exhausted after a week, it is very nice to be exhausted of a hard week's work than being exhausted of simply doing nothing. The latter is very poor for your health. So, offering paid employment for everyone, I think that is a crucial challenge in society. We have investigated different groups that were involved in getting back to a paid employment, like persons with a disability, with a mental handicap, and we saw that if they are included in paid employment, they feel valuable members of society. So their health may not necessarily from an objective medical point of view improves, but the subjective health, how they look upon their own life, that improves dramatically. They feel more energized, they feel more vitalized, they feel that they can do much more than they did in the past. And the same is true if you don't have the possibility to enter in paid employment, but to enter in society. So increase social participation. And one of my favorite examples is this sport clubs. This is a sport club of mentally handicapped persons. They are handicapped from young age, and they organize a sport club, and they have a special competition, and they sport with each other, and they have so much fun. So their health improves. And even better, the volunteers who are organizing this, their health also improves, because they feel energized and vitalized seeing these handicapped persons having fun in sports. So even if you are not able to be, a member of the workforce, being a member of society, being included in society, that is crucial. And that leaves me with the legacy of the great man himself, Erasmus from Rotterdam. Erasmus wrote about societies, and his main point was society is people living together. People living together. And my challenge, the challenges I see for society are living together, working together, and having a socially supportive environment. I think that will do wonders for our health. Thank you.